Hello, and welcome to Passing Medications, ASCP's Medication Administration video series. In the next 15 minutes, we'll examine some factors that can lead to medication errors and review the basic steps to ensure safe and accurate administration of oral medications. Computerized medication administration records, color-coded delivery systems, and a variety of unit dose packaging. These are just a few systems designed to assist in promoting accuracy and safety during medication administration. Yet, despite all technologies available today, one overwhelming problem still exists: medication errors. According to the National Coordinating Council for Medication Error Reporting and Prevention, a medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. Think medication errors are not a concern? Think again. According to the Institute of Medicine, at least 1.5 million U.S. residents are harmed or killed each year as a result of medication errors. According to studies, the most common type of medication error or errors seen in the long-term care setting is omitting a dose or failing to give an ordered medication. Omission can occur when orders are not transcribed or documented properly, when medications are passed quickly without checking that all medications have been administered, or when medications stored in alternative locations are overlooked. Other common errors include administering too high or too low of a dose, administering the medication at the wrong time, meaning more than an hour before or after it's due, administering medications after an order has been discontinued, administering the wrong medication altogether, and failing to document new medication orders, order changes, and actual administration on the Medication Administration Record, or MAR. There are a few medications repeatedly involved in the most serious medication errors. These are known as high-risk medications. Special attention should be paid to these medications at all times, especially during administration. They include warfarin or Coumadin, insulin, digoxin, oxycodone and OxyContin, potassium chloride, furosemide or Lasix, and lorazepam or Ativan. Let's look at some examples of actual medication errors. Mrs. Jones moved to another facility, but her medications were not taken out immediately. One of her medications was digoxin. Mrs. Jackson, her previous roommate, also receives digoxin. The medication aide starts to prepare Mrs. Jackson's medications Monday morning. She reaches for the digoxin box, sees the same room number, a name starting with the letter J, and the label for digoxin, and administers the medication to Mrs. Jackson. Unfortunately, she inadvertently grabbed Mrs. Jones' digoxin, resulting in administration of twice the prescribed dose. This is deemed a significant error because digoxin is a high-risk drug. As a consequence of this error, Mrs. Jackson experienced a fall secondary to digoxin toxicity and had to be hospitalized. Let's look at one more case. Mr. Henderson receives oxycodone oral concentrate for pain. The dose is 5 milligrams or 0.25 milliliters. The nurse cannot find the dropper that normally comes with the medication, so she uses another oral syringe. The oral syringe does not have pre-marked dose increments like the one that comes with the medication. So the nurse draws up 2.5 milliliters, assuming that is the same as 0.25 milliliters on the typical syringe. The result? The resident receives 10 times the prescribed dose, resulting in respiratory failure and death. All are actual documented medication errors made by caregivers just like yourself, and are avoidable when the time-tested method of medication administration, known as the 5 rights, right person, right medication, right dose, right time, and right route, is put into action without fail. There are multiple steps to proper administration. Some organizations may choose to emphasize 6, 7, or more rights of administration instead of 5. For simplicity's sake, this video will stress the 5 basic rights, while covering other important aspects of medication administration, such as administering the right dosage form, giving the medication for the right reason, conducting the right assessment, and performing the documentation in the MAR. Let's observe our nurse as she applies the 5-right triple check system into her medication administration routine. After her hands are washed, she prepares the medication cart by ensuring medication and drinking cups are stored upside down to prevent any possible contamination. And MedPass adjuncts, such as applesauce and juices, are in covered containers and dated when opened. Fresh water is in a covered pitcher, and the pill crusher is clean and free of any residue. Our nurse checks the medication administration record, or MAR, and sees that Mrs. Manfree's routine medications are due. Before preparing, she checks the picture ID, looks for any assessments or monitoring parameters that may be required, and takes this opportunity to ask Mrs. Manfree about any pain or discomfort.
Hello, Mary Lou. Can you please verify your last name?
My last name is Manfree.
Thank you. Are you having any discomforts this morning?
No, I'm not.
That's great. Are you ready for your medications?
Yes, that'll be fine.
Okay, I'll get them ready and I'll be back.
Okay, fine.
Returning to the medication cart, the nurse cleanses her hands with an approved hand sanitizer and begins to prepare the prescribed medications by comparing the medication label to the MAR, each of the 5 rights. Right person, right time, right medication, right dose, and right route are checked before removing the medication from the medication cart, before removing the medication from the package, and before returning the package back to the cart. The 5 rights are always checked 3 times prior to administration for accuracy. This process is repeated for each medication until all Mrs. Manfree's prescribed 9 a.m. medications are prepared. If a medication with an active order is not available in the medication cart, first check other areas of the medication cart and the medication room in case it has just been delivered or has been placed in the incorrect drawer. If it is not located, contact the pharmacy. It is not acceptable to write NA, meaning not available, on the MAR without researching the situation further. When administering medications from blister card or bingo card systems, press the blister from the top using your thumb and push the tablet out while holding it directly over the medication cup or souffle cup. For unit dose systems, peel back the paper film and tip up the pod to drop the tablet into the medication cup. Liquids are poured at eye level on a flat surface. Measure the volume from the bottom of the meniscus or curve. Remember to use a calibrated measuring tool, such as a syringe, dropper, or measuring cup, when administering liquid medications. And use the appropriate size oral syringe or dropper when measuring small or odd dosages. The most appropriate syringe or dropper for a particular medication or dose is usually dispensed with liquid medications. Also, any liquid labeled as a suspension, or the abbreviation SUSP, should be shaken well before pouring to ensure the correct dose of medication is administered. Note that the oral liquid potassium is diluted with 4 ounces of juice, which is specifically ordered for Mrs. Manfree. Whenever administering liquid medications, always be sure to check the package insert for any manufacturer dilution recommendations.
Come in.
Mrs. Manfree, this is your Lasix, your aspirin, and potassium. Do you have any questions about your medications?
No, I haven't.
Okay.
When presenting the medications, our nurse ensures Mrs. Manfree is in an upright position and offers sufficient fluids and any special instruction about the medication. The nurse observes Mrs. Manfree and remains with her until all medications are accepted. At no time are medications left at the bedside for later consumption.
Okay, Mrs. Manfrey, I'll be back to check on you later, and you have your call light if you need anything.
Okay, thank you. I got it right here.
You're welcome.
Immediately following medication administration, our nurse returns to the medication cart, cleanses her hands with an approved hand sanitizer, and immediately documents all medications administered. She will continue to monitor Mrs. Manfrey for any potential medication side effects throughout her shift. The nurse is now ready to repeat the same process for each person with medications due at this time. We have reviewed the practice of using the 5 rights to ensure a safe and accurate medication pass. But what about those persons that require pill crushing due to difficulty with swallowing, or the resident that refuses their prescribed medication regimen? Medications can be crushed and placed in an approved medium, such as applesauce, only when a physician order stating "may crush medications" is obtained. But remember, enteric-coated tablets and time-released capsules can never be crushed. It's recommended that nurses be familiar with a "do not crush" list, which can be obtained from your pharmacy. If a resident has difficulty swallowing a tablet or capsule that is on this list, notify the physician and request an order for the liquid form of the medication or a therapeutic interchange that can be crushed. When using a standard pill crusher, place the tablet in a medication cup. Place another cup on top. Then use the crusher device. This keeps the crushing device clean while preventing medication loss. At no time may a caregiver crush medications and put it in the food of a person that has refused his or her prescribed drug regimen. Persons have the right to refuse, and all refusals must be addressed according to your facility policy. Usually, such policies include notifying the physician, documentation of the refusal, and care planning. Other medication administration principles to keep in mind. Maintain infection control standards in your facility. Remember, good hand hygiene practice is the #1 way to prevent the spread of infection. Store all internal and external medications separately. Medications are considered to be given at the right time when administered within 59 minutes prior or 59 minutes after the time ordered. Remove all discontinued and expired medications from the medication cart immediately. Never leave your medication cart unlocked. Always check the person's medical record for any allergies before administering a new medication. Notify the physician immediately of any suspected medication-related side effects or adverse reactions. Never administer medications that you did not prepare. Wear gloves whenever the handling of a medication is required, such as placing a sublingual tablet. Medications can never be stored at the bedside without a physician order and a self-medication administration plan in place. A person's privacy is to be protected at all times. Never leave a medication administration record visible for visitors to see. Offer fluids when administering medications. This is particularly important for certain medications, such as fiber and bulk laxatives, non-steroidal anti-inflammatory agents such as ibuprofen, potassium supplements, and osteoporosis medications. Some medications need to be administered with food or antacids to prevent stomach problems or gastrointestinal bleeds. Pay particular attention to medications ordered to be administered with food. For example, non-steroidal anti-inflammatory medications should be taken with food. PRN medications, taken only as needed, should have a specific reason for their use. Adhere to any instructions regarding maximum daily doses. And be sure to document the resident's symptoms prior to administering any PRN medication, along with the response or effect of the medication. Remember, you are ultimately responsible for ensuring safety and accuracy during medication administration. The 5 rights triple check system, when used without fail, will help to prevent medication errors in your facility and very possibly save a life. Now let's review some key points about the medication administration process by answering some situational questions. When checking the 5 rights during medication administration, the nurse compares A. the physician order to the MAR. B, the pharmacy label to the MAR. C, the pharmacy label to the physician order. The correct answer is B. The nurse checks the pharmacy label against the medication administration record. If this comparison reveals any discrepancy, the nurse must then check the physician order for clarification. The correct procedure for pouring liquids is A. Draw up all liquids using a calibrated syringe. B. Place a calibrated medication cup at eye level and pour. Or C. Place a calibrated medication cup on a flat surface and pour the prescribed amount. If the amount is less than 5 cc's or an unusual dose, a calibrated syringe is required. The correct answer is C. Always use a flat surface when pouring liquids, and if the prescribed amount is not calibrated on the measuring cup, a syringe is required. We hope the last 15 minutes was a helpful review. If you have questions or need clarifications, be sure to ask your presenter. Remember, the 5 rites performed 3 times prior to administration, combined with an alert nurse or medication aid, is a prescription for a safe and accurate medication pass. Thank you for your time.